Hello friends, I have a small health update to those who are curious. I'm going through a hydrocephalus spell. It comes and goes every 3-4 months, so pressure builds up in my brain and it's not good, but it just takes time for the areas where the tissue is traumatized. There's inflammation, and then there's small drainage valves that close. They don't drain like they're supposed to, and then pressure builds up. It's a closed system, so the good fluid can't get in. I've been trying very hard to get the fluid to release. It's very tedious, challenging work. It's a lot of little things that add up to get some relief, and but it's a grind. I'm not complaining. It's what it is. So I just had one of my doctor appointments yesterday, and the doctor is recommending that because of my weird reaction with lidocaine or lack thereof, and the injections I had a couple weeks ago because we were getting ready for ablations on my discs, I had a strange reaction and my body didn't take the lidocaine, and so my doctor was like, that's not normal. He's like, I think you should, he said, we'll give you an IV, a whole bag of lidocaine, put it in your veins, and see what happens. So I'm like, oh boy. And then he said, because of your complex PTSD and your response to different things over the years, I keep having stress episodes. It's a stress disorder. And when you're stabbed with 7 2-inch needles, you're going to respond to the pain. And he noticed that. And so he's like, what we can offer is IV injection of lidocaine. Once you have that in your body, then you get another pill, an oral precursor called mexaltine. And then apparently mexaltine it helps promote, or how do you word it? It helps the body produce its own lidocaine. So I get the IV injection, lidocaine through the system, and then I take the pill, and then my body makes its own lidocaine. And that should bring all the pain down because my PTSD is way up, and so everything is kind of heightened, high alert, sensitivities are up, everything is kind of up, and that's the autonomic nervous system. It's got its own mind. You can't control it. It doesn't like what's going on in my body, in my life, and so it's doing these things so that I stop. And I guess I'm stubborn, and I'm not stopping. I don't know, it's my Asperger's maybe. But that's what happened yesterday at the doctor's appointment. So I had to relay that to my other primary care provider. I see her every 6 months, and she's like, okay, we're all on board of it. So that's in the system, waiting for doctors to get in touch with me. In the meantime, I have neurology appointments next week. I have a neurosurgeon appointment talking about my syrinx and my spinal cord and getting shunt surgery for that to release the pressure in my spinal cord so it doesn't tear any more than it has. I don't know how that goes, but it's a big needle and it's a shunt, and they stab it into the cyst, syrinx, and then it drains the fluid so that it prevents rupturing from within, rupturing of the neurofibers of the spinal cord. Then they separately have been talking to Johns Hopkins University School of Medicine. There's a teaching hospital? I don't know what they call it. So Johns Hopkins, they're with the VA network, so I'm hoping to get MRIs on my spine to see where things are, but also on the back of my head to get shunts shoved into at least 2 of the 4 vestules that, so they put these plastic tubes in your body and they stab those chambers with like an IV, a needle, and it drains the fluid because the other drainage fluid is not coming through. Such a busy intersection all day. Strange. So that's my little health update. We're doing MRIs to rule out hydrocephalus, but we're pretty certain I have it. 3 of my doctors think I do, but you have to get an MRI, a specific MRI, on the brain and the back of the head where the tonsils and the vesicles are that drain fluid. If they're traumatized and plugged, damaged, I think they are. It just makes sense. A lot of my neck pain is down back there, but also a lot of the pressure that builds up for migraines is, because of that. So lidocaine, MRIs, and 2 shunt surgeries to help release the fluid buildup. So I gotta slow down. I gotta get ready for mass. It's in the morning, so I gotta do it now before in the evening. Otherwise, I won't be able to do it. Later on, I'm gonna go deer hunting and chase some whitetail. I've been bow hunting, and I got 2 bucks. I had 3 big bucks on my radar, on my in my cameras, and one of the other hunters got one of the bucks. That's such a gut punch. So I'm gonna spend time in the woods. I'm gonna spend time in my stand, which helps with everything, helps health-wise. Spending time in the woods, every day throughout October, November, I'm in the woods. I hunt pheasant, grouse, and then deer hunting. I'm actually interested in ground hunting, so I've always been interested in stalking and hunting deer. That's the next level. So that's my day. God bless.